Hello everyone. Today we will study about monro-kellie hypothesis. Let's start. Monro-kellie hypothesis is a fundamental concept in neurology and neurosurgery that describes the relationship between the volume of intracranial components and intracranial pressures. According to hypothesis, the total volume inside the skull remains constant and any increase in the volume of one component must be compensated by a decrease in the volume of another. The components of the intracranial space are as follows. First, brain tissue. The brain occupies a significant portion of the intracranial space. It consists of gray matter, that is cell bodies, and white matter, that is nerve fibers. Changes in brain tissue volume can occur due to swelling, inflammation, tumors, or hemorrhage. Second is blood. Blood vessels supply oxygen and nutrients to the brain. The intracranial blood volume can change due to alteration in arterial or venous blood flow, such as vasodilation, vasoconstriction, or hemorrhage. Third is cerebrospinal fluid. Cerebrospinal fluid is a clear fluid that surrounds the brain and spinal cord. It provides buoyancy and protects the brain from mechanical forces. CSF volume changes can occur due to alteration in production, absorption, or obstruction of CSF flow. According to the monro-kellie hypothesis, an increase in the volume of any of these components, such as brain swelling or bleeding, will lead to a subsequent increase in intracranial pressure. To maintain a constant total volume, compensatory mechanisms come into play, redistributing or reducing the volume of other components. For example, the brain may compress or deplete CSF or blood vessels to accommodate the increased volume. If the intracranial pressure continues to rise and compensatory mechanisms are overwhelmed, it can lead to serious consequences such as reduced blood flow to the brain, herniation of brain structure, and potentially life-threatening conditions. Understanding the monro-kellie hypothesis is crucial in diagnosis and managing conditions that affect intracranial pressure, such as traumatic brain injury, brain tumors, stroke, and hydrocephalus. Monitoring and controlling intracranial pressure is vital to prevent further brain damage and optimize patient outcomes in these situations. Thanks for watching this video.